Welcome back to KTN News Center. This morning we are having a conversation about drug abuse and illicit trafficking as the country joins the rest of the world to commemorate World No Drug Day. And to help us with this discussion in studio, we have Rachel Kitonyo. Rachel is an expert and a lawyer at the same time. And we also do have Thomas Lindy, who is a coordinator at the Kenya Tobacco Control Alliance. Rachel, let me begin with you this second half. Let's talk about the burden of drug abuse and drug and substance abuse in the country. I'm talking about burden in terms of statistics, numbers, gender and age at the same time. Where are we?
So, as I said, starting off with what are the drugs we should be concerned about.
Yeah.
So our alcohol prevalence is at about 23%, followed by tobacco use, which is at about 13% in terms of the national average. So of course there are regional and geographical differences, and even age group differences. So I'm talking about national averages. And then you have got cat, miraa, muguka, about 6%. And then you've got cannabis. And then finally down there at the bottom, you've got the hard drugs. But that's from the latest NACADA study. The rider that they give is that because people who use hard drugs, all the others I've mentioned are legal. So you can buy them without fear of prosecution. And therefore people are more likely to own up to using them if they're asked. For these others, because they're illegal, if you do a household survey, you'll hardly find someone saying that I'm a cocaine user. And then, of course, they may also not be found at home. They may likely either be on the street or already in a rehabilitation center. But overall, the biggest drug in Kenya is actually alcohol. And that's why I was saying we have a problem because we don't think it's such a big problem, but it is. And even in terms of what you call alcohol use disorder, which is when now it has become a problem. So you're addicted and it's affecting your daily life, or tobacco use disorder or cat use disorder, which means it's interfering with work, it's interfering with social life, it's interfering with family. You're spending increasingly large amounts of money, so it's interfering with your pocket. That's what now we call a disorder. And so if you're talking about alcohol use disorder, it's at 10% in Kenya. So 10% of Kenya has got an alcohol problem. Given we are a population of 50 million, that's 5 million people. It's scary. And this has an impact on people's finances, how much money they deviate from food, from school fees, from healthcare to fund addiction. It has a problem on relationships, so families are breaking apart, families are breaking down. And because most of this is men, we are losing our fathers, we are losing our brothers, and then the other critical age group that's being affected is the age group 18 to 25. This is an age group where one, brains are still developing, and then two, they are supposed to be productive. And so if this is the age, because in terms of age of initiation starts off at about 7 years with tobacco, alcohol 8 years, cat, miraa 9 years. But the average age now of use moves into teenagehood. And then for heroin and cocaine, it's at about age 18. And so if we're going to look at how to protect these young people, that's why I was talking about access, I was talking about marketing. So we like thinking that we are dealing with adults who can exercise will. But 8-year-olds have got no will to exercise. And the law does not treat them like they make choices. Therefore, the choices are being made for them by companies that are marketing to them substances that they know are harmful and that are addictive. And they want to addict them at that age. And so the problem groups in the country are men. And so even when we look at messaging, it must be gender sensitive. And even when we look at how to reach them, where are men to be found? So for women, I guess I'm a woman, maybe Lindy can talk about where men hang out. Women, we go to church, we go to chama, we talk, So we must just tailor how we are doing the messaging so that it's got a gender slant. And then to that age group of 18 to 25. Because that's where we must do the prevention. And then because the age of initiation starts from 6 years, then for all of us who are parents, you must be very worried about your child. And the last thing that the NACADA surveys have shown is that there's actually a lot of exposure at school. And our children spend a lot of time at school. So the school environment and the home environment are really critical for the messaging so that by the time our children hit teenage, they have learned that drugs are bad. They have learned how to resist peer pressure. And so in terms of life skills training, and then even for us as parents, to know how to speak to our children so that by the time they reach that age where they meet their first encounter with a bottle of Tusker, the first encounter with a cigarette from a friend saying, try this, that first roll of bang that a friend whispers to you about, our child has got the capacity to be able to say, no, this thing is bad and I don't want it.
Yeah, and Rachel, you'll help us also highlight how parents who have children that are already abusing drug, and I'm talking about under 10, under 18, should do, because it's overwhelming right now to parents and what they can do, you know. But Tom, let's talk about, we already have a program that is has already been rolled out on helping the farmers that are growing tobacco transition to their alternative crops that have been introduced by organizations like yours. So what sort of programs do you think can aid in the fight? Because there are people making money out of this. There are people who think that this is my only source of livelihood and I cannot survive, for example, if I'm not selling tobacco, if I'm not selling some of these illicit brews. So what alternative programs do you suggest to the government that if this is implemented, then probably in the next 5 or 10 years, we can have this conversation behind us?
I think there is need for increased awareness and also public education. Apart from us just targeting the farmers and trying to make sure that we have low acreage in the planting of tobacco, we also need to have a lot of awareness going around. Just like Rachel has said, at that critical age when the kid is still developing, that's when we should actually target them and ensure that they get the message. She also said about where do we get the men, and you will bear witness that most of the men, nowadays we don't have so many stadiums around, but when you visit the few that we have, there is a lot of abuse of drugs in the stadiums themselves. I've actually gone to a football match and I was actually horrified on the way the drugs are being abused in the stadiums, including cannabis. Go to City Stadium, go just to watch any match. You'll be surprised how the fans are using a lot of drugs. Alcohol is being sold there and all that. So as we reach out to these groups, it's also good that we also tell our message in such a way that they get the educative part of it, not just condemning them, so that you find people who are depressed because of the harsh messages that they're getting outside there. You have talked about the issue of farmers and the other programs. So this program that we have in place, trying to move farmers from tobacco farming, is a good program. And we believe that when effort is put in it and we expand it, so that it's not only in Migori, we go to other counties, and more people get to understand what we are talking about, it will help a lot of people move out of tobacco farming. Apart from that, the issue of the other drugs, I think there are many other initiatives. Specifically, when it comes to alcohol, we can have the rehab centers and also messages, maybe from the Ministry of Health. We need to have health messages also running in our TVs each and every time, that maybe those are huge traffic hours. Messages from the Ministry of Health, messages from NACADA and the rest, that can be able to help our people understand more about the issue of drugs.
And so Rachel, how do you help a parent that has an underage child that is already abusing one of these drugs, and are there centers that could help these children?
I think the first is being able to accept that your child has a problem. Sometimes you're told and you say, no, that's not my child. You know, unamwekelea. And so it's also being able to recognize what are the signs. Very often when they start drug use in school, because a lot of them are in boarding, particularly in high school, you don't know. So they start in Form 1, Form 2, Form 3. And you'll be finding out much later, just because you're not physically there with your children. So one, for us as parents, is how much time we spend with them. 2, on the NACADA website, there's a list of rehabilitation centers. And so going back to that whole thing of stigma, many people are afraid of saying my child has a problem because of the stigma attached to it. And so if we got rid of the stigma, and just the same way you say my child has got flu or has got malaria, and you take to the hospital, it's the same way your child has got a substance abuse problem and you take for treatment. So it's treatment. And a lot of people used to think of places, because even when you talk of mental health, Mathare is thought to be a place for mad people.
Yeah.
No, it's just a place where people with a mental health problem are treated.
Yeah.
So rehab should not be taken as, oh, in the village when they hear my child went to rehab, it's a bad thing. And so there's a list on the NACADA website where you can get the nearest rehab next to you.
Yeah.
There's also a toll-free line, 11-1192, where you can call and get a counselor on the other end. And unfortunately, the NACADA survey indicated only 10% of people know about this toll-free line, and only 18% of people with a substance use problem have actually sought treatment in the last 1 year.
Yeah.
So we need to do more about creating awareness. So again, I repeat the toll-free line, 1192. It's free. It will not cost you anything. You call and you get a counselor, and after they talk to you, they can tell you where to go. And then the third fact for people to know is that rehabilitation is actually paid for by NHIF. They don't pay everything, but they pay a substantial amount. So they pay up to 60,000 per person who's covered on the card. And so it will not cost you that much to get treatment.
Yeah.
So there is help available. NHIF covers some of it. And the one that doesn't cost anything is that line, 1192. Please call and talk to a counselor.
All right. And so, Tom, why should we ramp up awareness against drug abuse? What is the impact of drug use in a nation, economically even? Rachel talked about the health impact of some of these drugs if abused, but let's talk about what it means if a country has the larger percentage of the group, especially the young people, abusing drugs. Yeah.
First of all, there is likely to be increase in incidence of crime.
Yeah.
Because a lot of people who have been reported to commit some of the crimes are under the influence of drugs. Yeah. So if we have so many drugs around, and some of the people maybe they are addicted and they cannot access the drugs, what do? They end up getting involved in crime. Some of it petty crimes, maybe at a family level. You may find a teenager selling some of the household goods, anauza viatu za baba, the rest some koti, vitu kama hizo, utensils and such. And when he's out there, he'll be able to engage in some serious crimes, maybe. Yeah, so that's one of the challenge. If we have a country having a lot of cases of drug use, that's one of the challenge. The other one is the issue of family disintegration.
Yeah.
You'll find that the family will break up maybe because people cannot understand each other when they are in such a case. And in Kenya, we have seen a lot of issues with also domestic violence. A lot of domestic violence cases are also linked to use and abuse of drugs.
Yeah.
Yeah. So if we don't curb that, we'll have a nation whereby the basic fabric of the nation, which is the family level, it's actually torn apart, and you'll find we have so many issues happening around. So apart from that, there are also other issues with the spread of diseases, common transmissible diseases like HIV and AIDS and such. If we have a huge population of our people using drugs, they are in that state that they cannot make their judgments very well. And we have also issues of accidents, like you see road accident. A lot of cases have been attributed to use of drugs and such.
Yeah.
So it's a whole collection of problems that if we don't curb it at that level, we'll find ourselves maybe having a lot of issues in our society.
Yeah, and Rachel, you said that only 43% when asked why they don't abuse one of these drugs, they say it's because of health-related issues, that they know that these drugs have health-related complications. So, which is again a concern, because everyone should be able to know that this kind of a drug has a health implication. So we talk about the health impact of drug and substance abuse, because some people think that taking alcohol probably will aid in digestion, and other misconceptions that are out here. Yeah.
So starting off with alcohol, the science is now clear. The harm from alcohol is dose dependent. So the old thing that a little is good for your stomach,
yeah,
or even for your heart, there are less harmful ways of having a good heart purity. You want a good heart, go and take a 30-minute walk outside. You don't need to drink alcohol for your heart. So the more you drink, the worse the harm. And so alcohol has been linked to cancer. About 10 cancers are directly linked to alcohol. It's been linked to diabetes and hypertension. Of course, he mentioned the linkages to domestic violence, to the spread of diseases like hepatitis and HIV, just because of lack of inhibition when people are under the influence. So there really cannot be an argument that any amount of alcohol is good for you. So the less you drink, the better. In terms of another one where there's a lot of misconception right now is Miraa.
Yeah.
And just because Miraa is legal, and there actually seems to be an effort to promote it,
yeah,
many people are not aware of the harms. Now, for example, when you look at depressive disorders and the links between depression and use of these substances, the highest depressive link is with alcohol, followed by Miraa, and then tobacco. So for all those who think that Miraa is harmless, it is not harmless. It is very harmful. And even when KEMRI was asked to do a study, remember the time when people in Meru were urging the government to try and improve Miraa marketing. KEMRI was tasked to find some benefit from Miraa. They couldn't find any. So there's no health benefit. It does not give you any nutrition. There's nothing that Miraa helps you with. And then now, of course, there's this risk of increased depression. And remember, cases of suicide are also high in the country. They're rising. So the link between all of these substances and depression has now been established.
Yeah.
So from the health perspective, really, all of these substances are harmful. And part of what we have to deal with is that social acceptability. So for alcohol, we've got high social acceptability. And then the other thing is even that word harmful use of alcohol, which to some implies that there's some beneficial use. But as I'm just saying, the research now shows there really is no benefit. So there's no benefit for your heart, there's no benefit for your stomach, there's no benefit for your brain and your moods. So really, we have to deal with a lot of these misconceptions. Another one is again over cannabis. And of course, with it being one of the electoral platforms in the last election, there's now been a lot of information about cannabis put out, some harmful. And so then now a lot of people are thinking that because the West has legalized it, that then it is not harmful. It is also harmful. So the fact that something is legal does not make it healthy.
Yeah.
And we must always talk about the health harms, even if these substances are legal.
Yeah. And Tom, as we wind up, the General Assembly, of course, decided to observe the 26th of June as an International Day Against Drug Abuse and illicit trafficking. And the aim was to ensure or achieve an international society free of drug abuse. So how can this be achieved here in Kenya?
I think in Kenya, one of the ways is to strengthen our laws so that we actually have a different way of looking at these drugs. And as Rachel has said, there is a lot of science which is coming up. And we should follow this science, see where it's leading us, and maybe use it for the benefit of the country. Because of the harmful effects that we have all mentioned here, I think there is a huge concern that each and everyone should actually maybe be concerned about this. And it's good that our politicians, especially our Deputy President, has actually seen the harm that is causing to them, to the community back there at home. But it shouldn't be about Mount Kenya only. This is a national problem. So we should not leave the battle to the Deputy President alone. The President should pick it up. And each and every one of us at the national level, counties like Mombasa, that's a place that we should actually focus more, because there is a lot of those drugs that are coming in. And also the international efforts, because it's an international day, we should have international efforts, different countries coming up, sharing intelligence, sharing information, and also learning from each other. I believe that there are countries who have been able to deal with the issue of alcohol to a good extent. For example, last year we had the World Cup, and it was in Qatar. And one of the things that was absent was alcohol, or it was minimized. And people were crying left, right, and center. Oh, hakuna pombe nini. But the World Cup went on well, and it was successful. So it doesn't mean that if we remove some of these drugs from maybe community acceptance,
Yeah.
some of them embedded in our cultures, cultural practices. It doesn't mean that if we remove them, we won't be able to go on as a society.
Yeah.
So we need that collective effort, national, international, and also our religious organizations, community organizations. Each and every organization in our country should be actually come up and have a say on this matter.
Yeah. And Rachel, time is not with us, but maybe in 30 seconds, there is a goodwill from what the Deputy President is saying, but as an expert, what laws would you wish to see put in place as far if the country is to successfully fight substance abuse and illicit trafficking? Yeah.
So for alcohol, we have just removed the inflation adjustment on taxes, Section 10 of the Excise Duty Act. Next year, return it. Deputy President, help us. We need it back. Raise taxes. Deal with alcohol marketing. It's everywhere. For the hard drugs, we have to deal with precursor chemicals. So for example, for illicit alcohol, the diversion of ethanol.
Yeah.
We are not adequately controlling. So these are precursor chemicals, things that are used to make the actual hard drugs. We need to tighten that element of regulation. And then we need to start prosecuting big fish. As I said, leave the small one guy with one roll of bang, go for the big fish.
Yeah, all right. Rachel and Thomas, Lindy, thank you so much for making time for us this morning as the world commemorates a day against drug abuse and illicit trafficking. I appreciate your time.
Thank you.
All right, and that's all the time we had for the News Center this morning. Many thanks for your company. My name is Purity Museanzuki. I'll see you again at 1 o'clock.